In part 2 of this month's Health Check, we're continuing our conversation about urology with Dr. Mendoza from WVU Medicine Camden Clark Medical Center. Dr. Mendoza, thank you so much for sitting down with us again.
Thank you for having me, Andrew.
Of course. So the first question I'd like to ask you is, how important is early detection for your urological conditions?
So one of the major things that we deal with is prostate cancer. It's, other than skin cancer, it's actually the #1 cancer in men.
Mm-hmm.
So the way we go about screening these men are with a blood test called a PSA, which stands for prostatic specific antigen. Typically, we recommend a man get screened with a blood test at age 50, but if there's a family history or if they're African American, they're at an increased risk for prostate cancer.
Mm-hmm.
So in those men, we recommend 40. And in addition to the blood tests, we also recommend a digital rectal exam at the time of their screening too.
And are there any other forms of screenings? I know you're talking about prostate cancer specifically, but other urological conditions. I know you just mentioned another one there too at the end of the question, but that people should be getting screened for. What kind of ages and times does that go for?
There's not an actual recommendation for screening, say for like bladder cancer,
Mm-hmm.
but we do know that patients who smoke are at increased risk for bladder cancer.
Right.
Unfortunately, also chemicals in the environment are make us at risk, and of course living in this area we have to be aware of that. So again, it comes down to that situation. If you have urinary symptoms or if you see blood in urine, then potentially that may lead to screening for a urinary tract cancer.
Okay, and so I do want to ask too, are there any lifestyle changes that people maybe should be thinking about making to prevent themselves having a higher risk of urological issues?
So the major one for cancer is again cigarette smoking, because that's been linked to bladder cancer. In regards to lifestyle changes for other urological conditions, one of the most ways we can have effect is on kidney stones, okay? Kidney stones develop most likely because of not drinking enough fluid, and that fluid should be water. We also generally recommend a low salt diet, less than 2 grams of sodium in a 24-hour period of time. And for most kidney stones, lemon juice actually is a stone inhibitor. So if you can drink 4 to 6 ounces of lemon juice across the day, a lot of people can't stomach it.
I'm not a lemon person, even in my water, so I can't imagine drinking just pure lemon juice.
Yeah, so you mix it with the water, the best way to do it, obviously, like lemonade. But that's a very important situation because we do live in what we call a stone belt. So kidney stones are fairly prevalent in this area. And the other thing too is we call it an acid ash diet. So a lot of people are now on this high protein kick.
Right.
Unfortunately, high protein diets also lead to kidney stone formation.
Okay, so another question that I do want to ask you is, can you discuss any of the recent advancements in the urological surgery and treatment part of your field?
Yes. So as with most surgeries now, a big issue or a big offering that we have at Camden Clark is robotic surgery.
Oh, wow.
We have 2 new robotic surgeons that have been with us for almost 3 years now. So our major cancer type surgeries that we do in regards to kidneys, bladder, prostate, ureter, those type of things can now be offered as a robotic surgical procedure. That offers quicker recovery time, generally less pain, less hospitalization time. In addition, we also offer minimally invasive prostate treatments for just benign prostate conditions, which a lot of older men suffer from. So there's a lot of advances being made in these minimally invasive type procedures and advancements also in cancer treatments through the oncological viewpoint.
And so to tackle that and continue on off of what you said, is there any surgeries, any kind of condition specifically that maybe robotic would be preferred over kind of the general, the more mainstream surgery that you guys normally do?
Yeah. So robotic prostatectomy or radical prostatectomy using a robot has really taken over. The majority of patients now will get a robot prostatectomy. That's probably the #1 use for robots in urology, but they also partial nephrectomies, taking out part of the kidney, and also you can do radical nephrectomies, you can remove bladders, you can pretty much do all the major oncological surgeries with a robot in regards to the abdominal cavity.
Right.
For testicular cancer, doesn't have a place because you're dealing with something that doesn't need to have that advancement.
Now, before I let you go, Dr. Mendoza, it's been a great 2 weeks having you here, but is there anything else, whether it was about what we talked about last Monday or tonight, that you would like to share with the viewers about urology?
Yes. I think the most important thing is we see a lot of patients that get delayed in investigation for like recurrent urinary tract infections, which sometimes can indicate a bladder tumor or a stone. We also see patients that are reluctant to see their physician just because of the anatomy. And I would say the best thing to do is to understand that early detection and treatment can change lives.
All right, well, Dr. Mendoza, thank you so much for sitting down with us the last 2 weeks and sharing your wealth of knowledge. I think I appreciate it a lot because it's something that I wasn't very familiar with, and now I have a lot more knowledge, and I'm sure our viewers feel the same way.
Well, I appreciate the time. Thank you.
Of course. When we return Mid-Ohio Valley, we'll have one last look at your forecast. Stay with us.